Hello friends, this video is for the newcomers. So those whenever someone is interested in pain medicine, few question arises in his mind. What is there in this subject? How to proceed? And which books to read? So let us see the scope of practice of a pain physician. If we see the whole pain management, whole subject of pain management, then intervention remains only a part of pain medicine. Of course, it is unique to this subject, but it forms a small part. All other management, it is actually overlapping with many other specialties. Now here rheumatology and neurology is of utmost importance. So the practice protocols or guidelines of neurology and rheumatology is also applicable to us. Of course, there are some guidelines and practice protocols of core pain medicine subject also. For becoming an efficient pain physician, you must also know, at least partially, physical medicine, orthotics, occupational therapy, kinesiology, sports medicine, and alternative modalities. So these are websites for guidelines and resources. When arthritis is concerned, then we mostly we follow the guidelines of ACR and EULAR. ACR means American College of Rheumatology, and EULAR means European Alliance of Associations for Rheumatology. When headache, we talk about headache, then we follow the guidelines of International Headache Society. They have the guidelines of ICSD 3 guidelines or the American Academy of Neurology. Both guidelines are important for our pain practice. Now, there are some organizations which form the guidelines about the core pain medicine. So, one is IASP, International Association for Study of Pain. This IASP has the branch of ISSP, which is the Indian branch. So ISSP also has some guidelines, and then comes ASIPP. So this is American Society for Interventional Pain Physicians. So they published a journal of pain physician. This name of the journal is Pain Physician. So this is a free content, and basically this is a good source of many information. And then there is another association, that is WIP, World Institute of Pain. They also have many guidelines. As far as book is concerned, for intervention purpose, you can read this. I shall vouch for this one, Interventional Pain Management, Image Guided Procedures. There are some Indian books. So this is an MCQ book. You can start with the MCQ book to understand the length and breadth of the subject, or otherwise this Basics of Pain Management. This is also an Indian book. And so for learning pain procedures, you can join Asian Pain Academy. We offer short-term trainings via online and offline. Volunteer or cadaveric workshops are also organized. But for long-term training, you can opt for ISSP endorsed courses. Thank you.